Hello and welcome to my channel. Today I'm going to talk a little bit about urinary tract infections and home test strip kits and why uh, you have to be very careful with these things. One of the issues with your home tests is they're not really as accurate as culture-based tests for urinalysis. Not that urinalysis tests are all that perfect either, because it's nearly impossible to get an uncontaminated sample from somebody's urine, especially if they have a catheter or uh, or elderly with dementia. Now, women get UTIs a lot, young and old, and these test kits are helpful, very helpful. Um, they're very useful if you have UTIs that keep coming back when you're younger. But when you're talking about older people, elderly people, people with catheters, that complicates the entire process because as people get older, they get more chronic illnesses that can masquerade as UTIs, where they'll give you the same results in a UTI culture test that isn't done as in-depthly as they should, because it could be other things. Now, with home test strips, you might run into the problem of well, you will run into the problem of contamination uh, for a lot of different reasons, which I'll try to get into a little bit of those. But medications that you take can affect the results of those test strips. So there are a lot of test strips on the market, so let's look at those. There are many different brands on the market. You can buy them at the pharmacy. You can get them online. Now, I'm going to talk about one that I'm most familiar with because I've tested many different types that show different things, limited amounts, one or two results, whereas some of them will show 3 and 4. So the one I'm most familiar with is Life 2O urinalysis, urinary tract infection strips, and they have 4 parameter test strips with UTI severity, leukolytes, nitrite, and pH level. Now, these are very good test strips. They are good product. The test strips appear to be reasonable, accurate, within reason, of course, reasonably. However, they do have a 90-day, 3-month shelf life after you open the bottle. This is stated on the box, but not the bottle. So if you ever get this brand, you want to make sure to keep it inside the box and write on the box itself, in the lid or something, the date you opened it. Because after those 90 days, give or take, the results will not be correct. Not that they might give you false positives anyway, or false negatives, but they will not be as expected. And I'll show you something that happened. Now, these top 3 test strips are from a brand new bottle that I opened. And the bottom 3 test strips are from a bottle I had opened for 6 months, but I had lost track of. I had forgotten about the 90-day shelf life. It's just something that didn't enter my mind. So I thought, these come with 50 strips. So you figure they'd last a long time. but I got to be honest with you, I forgot about it. But when I opened them, so I didn't know. So when I was getting these results, it didn't make sense to me because I'm used to the average color of the results over a period of time. I began to get suspicious because they were always the same. If you look at the bottom, they're pretty much the same. But when I tested it with a brand new bottle, very different result. Very different result. And there are color levels there. If you're colorblind, don't buy these test strips. But you can see that you see a very different result there. But you see, what I'm showing you now is a updated version that didn't used to say this. What it was on the front package, it didn't say UTI severity, it said blood. And so they changed this. And after they changed this, they came up with a different version. But going by the test results on the box that I had with the blood, leukocytes, nitrite, and pH, leukocytes was any positive result may indicate the presence of white blood cells, which can mean UTI is present. The nitrite was a positive result may indicate the presence of bacteria, which can mean a UTI is present. pH above pH 7.5 may indicate that the urinary tract is prone to a UTI, and blood, any amount of blood in the urine may indicate severe UTI. Now, the test can be influenced by medication. It can be influenced by detergents, soaps, disinfectants, alcohols. It can be affected by diaper. It can be affected by catheter. There's a lot of things that can affect this and or affect these results. So you have to be very careful before you jump the gun and start running to the doctor. Now, what I was using these test strips mostly for was to get an average range where I could, over time, see how things changed and see if the color remained constant or if there was more blood or more nitrates or more whatever's in there. And I would use that as a general thing, as a test thing for myself with knowledge of my loved one. But I learned very early on, you can't trust the results as a final result because the doctors won't take these results either, and they'll take a urine test at their offices, and even then, you're going to get contamination. If they send your loved one in, they always tend to send your loved one into a bathroom with maybe you to help you collect a urine sample. And especially with catheters, how do you do that without contamination? There's so many things that contaminate, and it's almost impossible to get around that kind of contamination. Like I said, with this brand, Life 2.0, it was a different box with the UTI severity, used to say blood. And then the new one that they are selling now is Life 2.0, upgraded V 2.0, is a 3 tester rather than the 4 tester. And they might suggest some other things, but there's 3 main tests they're looking for. The problem with any of these tests is they can be done or come back positive or negative, and that's an incorrect reading. Now, in this particular brand, there are 50 test strips in the bottle. So if you test 4 times a week for 3 months, it should be good. But if you do not test that this often, you'll probably waste a lot of strips. If you remember that the strips expire within 3 months of opening a bottle. So, and the cost for them isn't that much, but you could probably test every single day, but you need to make a point to test it at the same time every day. You also have to worry about concern yourself with catheter-associated UTIs, where you could have inside of the catheter tube, it builds bacteria and infection in there and transfers back up into the bladder and other areas and causes a UTI. And really, only most of them can be treated with antibiotics or the removal or the change of the catheter. And if you have to continue to wear the catheter or have the catheter, or your loved one does, the best time to test their urine is after they have pulled the catheter out, cleaned up the area, let him or her go a little bit to clear it out, and then test it, then take that fresh sample. So right after that, but even then, you have issues that can happen, especially with older people. And I'm going to show you a doctor who gives a very good video explaining the problem with urinalysis, the elderly, and overusing or jumping to the final conclusion of a UTI when it really isn't a UTI. This doctor, Viktor Kotarski, I hope I'm saying that right, has a very good video, which I'll put in the description, link to it in this, at the end of my video, who details all of the issues of over-testing elderly people and those with catheters and those who wear diapers or adult underwear, and the problem with contamination and how it's almost impossible to get a clean sample. So I recommend that you watch that because it's very interesting. It can be a little bit hard to follow until you've watched it a few times and made yourself comfortable with it. But this is some very good information on when you think somebody's got a UTI, they might not have a UTI. They might have something else, and a chronic problem. It could be a medication-based issue. It could be a kidney infection or other infection, which is causing the test results to show the levels of the leukocytes, or I can't say that word, but leukocytes and the nitrites, and even have blood in the urine, because blood in the urine can be caused by faulty catheter insertion, where they did it too roughly or they did it incorrectly, and also that there are vessels up in there that can break, and you'll have a blockage, blood clot or something in that area, which will break free after a while. Or they've been on antibiotics, and then they've got other issues. And too much use of antibiotics can cause C-Diff, which is it's not new, but it's almost an epidemic now that relates to diarrhea and an infection, a bacterial infection that is is rampant in hospitals and nursing homes. So I would suggest be very careful with home test kits. And when you want to take you want to test that over a long period of time, always at the same time, always try to get a fresh sample in the morning after they've been in bed all night. And if they got a catheter and a collection bag, you want to empty that bag, wait about 4 hours, or sit there and wait to get a new sample. Take the bag off and get that new sample, because there may be an infection, bacteria growing inside of the bag. So if you want as clean a sample as possible, you need to get it directly from the catheter and not from the bag. And it should be that urine that is after 4 hours of time. And then they've been in bed all night. It's that first urine of the day, basically. Or that first urine after being up for a certain amount of time. But you should get it directly from the tube, take the bag off, and collect it. You might have to sit there and wait for it and try to get them. Same thing with taking them into the bathroom. Have them go a little bit, wipe themselves off very good, go a little bit, hold it, which is hard to do with a dementia patient, and then have them go again into that sterile cup. And you got to have gloves on. You cannot touch their genital area. Without those gloves, you got to make really careful. If you want to get don't touch anything, don't contaminate at all, or try not to. And it's, like I said, it's almost an impossibility. But a lot of times when you think that a UTI is a UTI, they jump the gun at the test results and say, well, these levels say it's a UTI, end of story. Not end of story. Watch this guy's video, and listen to what he has to say, and watch a couple more of his videos where you might get a better understanding of why we're having so many urinary tract infections reported or results returned when hospitals and doctors are just jumping to that conclusion. And like I said, with older people, elderly people, they have more things going wrong with them, chronic things. And when you jump to the conclusion that they have a UTI, even if they're disoriented. Let me tell you something about doctors. Something I've learned taking care of my 91-year-old father is the older someone gets, the frailer they get, the less doctors really care. They sort of start planning around, well, but not to fault them, because there's not a lot they can do. They can't do surgery. Some of the treatments that might fix some things are not possible with a frail older person, especially someone with Alzheimer's and dementia, which causes brain damage, and they can't fix brain damage. They can maybe stave off progression, but they can't do that. And when other things are failing in their body because they're getting older and older and older, they start saying things like, well, you really don't want your urine tested unless you've got symptoms and there's no other choice. Because they know it's going to probably report a UTI. They're even going to assume it's a UTI. They won't look beyond that. Watch that doctor's video and you'll get an understanding of why they do that and why it's the wrong thing. But like I said, when your loved one starts getting older, or you start getting older, elderly, they just want to throw medications at you, and they don't do the in-depth testing that they need to do, especially, like I said, with Alzheimer's and dementia. A lot of doctors cannot get them through a procedure because they lose where they are. They don't know where they are. They're afraid. The results are always going to be skewed, and they don't do things, clean themselves properly. Their kidneys are not functioning. Their breathing isn't functioning. They've got other conditions they've had for years that are worsening, and everything becomes a chronic thing. So with UTI, home test strips, you don't jump to that conclusion that it's a UTI. Don't use those as evidence to prove, I suspect a UTI. Let's test him. Oh, it's a UTI on this result. Call the doctor. He's got a UTI, but they're going to test his urine too, because they don't trust those test strips, and neither should you. They're good for general reference over a long period of time, but they're not a sudden, this is good. You get a false positive, you get a false negative. You might get an accurate result, but that accurate result could be based on medication or something, cleaning product you used, or soap, or an infection from some other part of their body that's giving those two levels enough volume that they immediately jump to it, say you got a UTI, and throw antibiotics at you. But antibiotics can cause other things like C-Diff, diarrhea, and lots of other issues, and they become less usable. As you overuse them, they lose all their effectiveness over time. So be very careful. Don't trust them. Don't rely on those home test strips. But you can use them if used properly to get an idea if something isn't going right today, this week, and over the course of a couple of weeks or a month, you might understand your loved one has got an issue that we need to address this issue. But don't jump on and immediately tell the doctor, I think he has a UTI. When you go into the doctor, you tell them, if your loved one's not having any other symptoms related to a UTI, directly related to a UTI, you tell them, I don't want your urinalysis until we look into other things first. That's just my non-medical advice based on too many years of being a family caregiver and running through hospitals and doctors and nurses, all with their own different opinions on how to do things or not to do things because they think your loved one is too old and it's just part of where they're heading anyway. Take care, and I'll talk to you again another time.